We are pleased to have with us dynamic and brilliant international fertility consultant and director of BabySure IVF. Welcome, Dr. Atul. Welcome, Dr. Swati.
Thank you very much for your kind words and inviting us to your studio. Thank you.
BabySure IVF and your medical team is considered one of the best fertility services in India, and your center is also European Medical Association recognized center and have received various awards for your fertility services, especially in the field of IVF. Tell us about your journey.
We are practicing fertility consultants from last 18 years. We have successfully treated thousands of couples and thousands of babies were born by this wonderful technology. We have always updated our scientific and medical knowledge along with our laboratory and medical equipments. So, we constantly provide the best results that is giving us pregnancy and joy.
BabySure Fertility Center started with center in India and now gradually expanding into other international cities, where we have treated hundreds of patients coming from US, from Australia, from some European countries, from Middle East and the CIS countries also.
Could you please tell us about the technologies you use at BabySure IVF?
IVF is a very dynamic field. Over years, there have been so much understanding, in-depth understanding of IVF that the technology's face is always changing. That's what BabySure uses and adapts to newer technologies. And then there were many other problems which a couple used to face. For example, they face problem with low sperm count, and then we have technologies like ICSI coming, and then technology like PCOS coming up, and now we use the MAX system. We use sperm DNA fragmentation to understand what is the DNA of it. And now there are a lot of technologies which comes up and keeps on updating. Another technology is the use of genetic diseases. In genetic diseases, we can actually understand the genetic problem that a couple could have or the embryo could have. And because of these genetic diseases, we can identify more than 200 genes which can cause problems like blood cancer, thalassemia, and we can understand and avoid having such pregnancies. Overall, technologies like individualized or personalized embryo transfers using ERA test has given us a very high success rate. So there is constant, continuous, dynamic use of technology. Technology like time-lapse monitor and artificial intelligence is now becoming a core of an IVF lab and has added multiple folds to the success rate.
BabySure Fertility Center is well known for its high success rates in giving pregnancy. Please tell us more about these success rates.
As we earlier spoke, the success rate over any center is around 35% international level. But yes, BabySure feels pride to say it has got a cumulative success rate of 80% and above. Simple mean that we use technology along with the concept called as personalized IVF. We cannot imagine a couple A to have the same problem as couple B. So couple A and couple B can't be treated in the same fashion. So we need a personal attention to couple A and couple B. So that equals something called as personal IVF, personalized IVF, personalized hormonal treatments, personalized stimulations, personalized embryo transfer. And when you use a concept called as personalized, the success rate rises up. Let's imagine something called as personalized embryo transfer. If we see an embryo transfer, all around the world they used to do embryo transfer at day 3, and then they started doing embryo transfer at day 5, which is called as a blastocyst transfer. Now day 5 is like another 24 hours. And when you start doing a blastocyst transfer, the success rate is 35 to 55% probably. But why that remaining 100% is missing? That's where the science came into focus. Science understood if we have a blastocyst and we transfer a blastocyst into a woman's endometrium, the uterus, it will not stick. The time period for it to stick, which is called as window of implantation, exists for plus or minus 3 hours, that's 6 hours in total. So if we miss this crucial time of 3 hours, plus or minus 3 hours, the embryo could be excellent, the uterus could be excellent, still the cycle will fail. And this failed just because we missed a period called as window of implantation. So we use technology called as ERA technology, by which we can actually calculate the timing of when this receptivity is going to happen. So let me give you some examples. We have seen hundreds of reports of this. So in some couples, the timing might come at 72 hours. So definitely we have to transfer this embryo blastocyst at 72 hours, plus minus 3 hours, and not at 100 hours. We have seen timing come at 92 hours, 96 hours, 100 hours, 110 hours, 112 hours, 124 hours, 148 hours also. So you can imagine no two individuals will have the same time, and it varies from 76 hours to 148 hours. So if you see all the couples that we have seen who have failed 2 attempts or 3 attempts in the past, they have a discoordinated window of implantation. Everything is good. The blastocyst, the embryos is excellent, the woman is healthy, only the timing was a big mess. So when we use this technology called as ERA, we can actually correct the time. We can ascertain one time of 72 hours or 100 hours or 110 hours, whatever it is, and do a precise embryo transfer at that time. This is called as personalized embryo transfer, and the success rate goes up to 85%.
Very nice.
So when you use this technology in conjunction with all the other things that we are using in our laboratory, dream is just a step away from you.
Dear doctor, starting from centers in India and now moving to international cities, BabySure has got tremendous success at international level. So please tell us about your vision.
The BabySure team or BabySure family understands the individual, the couple's need, their need of having a child. They also have other problems like emotional stress, financial stress, their medical body parameters, their hormonal levels are imbalanced, psychologically they are under stress. So we have to treat these couples as an whole entity and not just as an individual medical entity. And every couple different. So you can't have a couple A as equal to couple B. So BabySure family strives in understanding what way we could make the patient comfortable, and that's how the vision of BabySure started. If we just imagine going for any medical treatment, financial burden is the biggest burden that a couple faces. So just imagine going to a doctor and a doctor gives a budget for any disease or any treatment. Let's say if it's $200, we all understand invariably we'll end up spending $300 or $400. That is 2 times more money actually than given estimate. Now just imagine if such amount of expenditure happens in costly treatment like IVF, the budget swells up. On an average, an IVF center will charge you around $2,000 to $2,500 for one IVF cycle. Now, just imagine if this budget shoots, there will be additional vitrification charges and some medicine charges, injectable charges, and this budget starts shooting up. Now, if this budget shoots up 2-folds or 3-folds, it collapses the individual's economy. It demoralizes them. So you start from $2,500 and you end up spending $3,000 or $3,500, and that's where the losses start in. And above all, what usually happens in an IVF cycle? According to all international IVF success rate, the average success rate is 35 to 40%. So what does it mean? It means that 65% of your patients are going to fail. 65% of your patients are going to need IVF treatment again, probably in another instrumentation or another technology form, but something or the other with IVF are required by the 65% of your patients. So this 65% patients of yours have to spend their budget again. So just imagine from the first failure they have spent $3,000, and again for a repeat cycle they are going to spend $3,000, and you really don't know what's going to happen with them. This amount of uncertainty we have seen because of lot of factors that come in. Patients get emotionally disturbed, they leave the treatment, they don't continue the treatment, and the treatment is left and the dreams are lost. This Baby Sure Fertility Center, Baby Sure family understands the essence of finance. So all our partners of Baby Sure came under one roof and decided to tackle this problem. How do we tackle this? Yes, Baby Sure has done this on two fronts. First, by addressing the financial front, and second, by addressing the technology front. Technology front, as Dr. rightly said, we are constantly updating our technologies so that we can give the best of success rate in the very first way. Now, it doesn't mean that for every added technology the couple has to pay. So the couple has to be taken care with finances also. So how do we care with finances? So Baby Sure Fertility Center started with one package. So a couple who comes to us gets one package of $3,500, and in $3,500 we assure them unlimited IVF cycles. It actually means we can perform on them 2 IVF cycles, 3 IVF cycles, and they don't have to pay anything. That includes even their injections, basic stimulation injections also. And this also includes other protocols like vitrification protocol, the sonography fees, and whatever other associated fees will be included in this. Now what does it mean? It's a 35% success rate we get in the first attempt, let's say, as other centers. For a second attempt, the patient don't have to pay any money from their pocket. The center will bear the charges because we have assured them of pregnancy. Even if it's a next cycle required, the couples don't have to pay anything. We will bear their cost because it's a commitment from Baby Sure. If we have assured you pregnancy, then we will use unlimited attempts, and within the given budget, we will give you pregnancy. And above all, even if it exceeds certain number of cycles, we will refund all your money back. 100% refund money back, including your injection cost. That is the confidence Baby Sure Fertility Center has. Now this confidence is a combination of our finances. It's a combination again with our medical equipments and our medical team also. So together, what patient gets is individual attention. They are guaranteed for the pregnancy. They know the budget given them is not only for one cycle, but irrespective of whatever technology doctor has to use, whatever the attempts the doctor could use, it's all covered. And peace of mind is what the patient gets. The couple knows once they are in Baby Sure Fertility Center, they are sure that they will go home with a smiling face and a pregnancy, because that's what Baby Sure Fertility team and family will always work for.
Dear doctor, how does your medical team keep update of all knowledge and latest technologies? I'm aware that your team participates in America and Europe and other countries for various conferences, training. Please tell us about this experience.
Our medical team actively participates in American Society of Reproductive Medicine conferences, European Society of Reproductive Medicine, Asia Pacific Society of Reproductive Medicines, and various other reproductive societies. This gives us an opportunity to interact with world famous scientists. We understand what's happening new in this field. We understand the medical updates that happens in this field. And also there are a lot of gadgets that comes in, day out. So there are many gadgets which helps us to understand and overcome a problem. So these are the gadgets and these are the science Baby Sure always thrives and tries to get into their practice. And that's how we keep our knowledge and our centers well updated and ready to give a very high success rate.
What advanced IVF technology are you going to use in Kazakhstan?
As I said earlier, IVF is a very dynamic field and there are a lot of developments coming every day, day in, day out. So in these countries also we will be bringing the best of technologies available in the world. It's going to be an IVF technology, it's going to be ICSI technology, it's going to be PICSI, it's going to be the latest MAX system for selecting the best sperm, and also we are going to use a genetic diagnosis technology which is called as PGD. In this PGD diagnosis, we can select a genetic free embryo and ensure that the couple has a child free of any genetic diseases. We will also be looking after something called as gene RNA technology called as IVF Technology, which gives us a personalized and individualized embryo transfer by which the success rate becomes 3 to 4 folds than the conventional success rate. Then we use technologies like Embrace, technology like detecting the microbiomes, technology like the mitochondrial count, the nuclear and the spindle fibers identifications. So there are a plethora of technologies that we'll be bringing to these countries by which we can actually assure every couple coming to our clinic to have a pregnancy.
Are you going to expand your BabySure IVF and its latest technologies to other CIA countries also?
If you think about BabySure family, it started with the concept of giving joy to every couple that seeks fertility treatment. You must see our medical camps that we organize. Hundreds of patients waiting for us, waiting for a medical team to see them on their appointment basis, and their only dream is to have a child. And with such sort of unlimited guaranteed scheme, with your money back if you fail, with such sort of support that you require from all quarters of your medical treatment, the response is phenomenal. We have seen hundreds of patients which have given up their treatment, which have stopped their treatment, but they again want to come back because they have seen that hope that they want. They have seen the confidence they want from a center. This center is not here to just make money from your one cycle, but they are here to give you pregnancy irrespective of the cycles that you take. So what does it give? It gives you peace of mind. You come to know if there is no pregnancy in the first cycle, you don't have to pay. The center bears a moral responsibility.
Really?
So because of this, every BabySure team becomes a BabySure family. And when you feel as a part of family, the commitment increases. We have seen this joy, we have spread this joy, and we want to spread this joy to as many countries as possible. And as we have started expanding to other countries, we have seen couples asking us to please have a medical camps in their cities. We seek a lot of partners seeking to do a joint venture with us so that we can give these technologies to their cities also. So yes, with the vision of BabySure, we are definitely looking to expand to other countries as well as CIS countries also.
Very nice. Is Miracle IVF Tashkent, Almaty and BabySure IVF the same?
Miracle IVF and BabySure IVF are one and the same. In fact, Miracle IVF is the name used in Uzbekistan, Kazakhstan and other CIS countries. They are one and the same.
Dear doctor, you have successfully treated and given pregnancy to a lot of foreigners. Please tell us about this.
BabySure team always addresses them as their family members.
Over time, BabySure has become synonymous with advanced technology, high success rate, and personalized, individualized treatment, personalized attention. And this has got global attraction. So when you get global attractions, and we all have these finances schemes which gives you guaranteed pregnancy, couples keep on coming in. They keep on coming from every country possible, every city is possible, because they want their dream to achieve. What's the dream is to have treated from the best of doctors, the best of science, within their own money, within the budget given to them, and to have peace of mind. So when these couples, they come to us for treatment, they are initially bit in a anxious mood. So our entire team, as doctor said, the entire team swings into action, treats them as family, takes care of their accommodation, rest, their food, dietary habits, their counseling part, and make the journey more enjoyable, relaxed. And our medical team does the medical workup. They do all the workup which is required and stand true to our name and the faith by which these couples have come. Overall, it's been a very humbling experience, and this once again raises the hope. It raises your own bar to give the best of the treatment to them. And that's one of the reasons why, because of these couples, these foreigners that we are treating, BabySure is expanding into their own countries and own their cities also.
How do you treat low sperm count?
Low sperm count or male fertility is 50% of the population that faces. So we see male patients having low sperm count, zero sperm count, and until now the technology was in two ways. If you have got a zero sperm count, they have to seek sperm donors, which is not acceptable. And if you have got low sperm count, then the treatment becomes lengthy. They keep on taking tablets and injections for years, probably 2 years, 4 years. Sometimes we see the sperm count to be okay, to be in few millions, sometimes the sperm count to be very less. End of the day, after years of wait, very few, maybe 4% or 5% individual actually have pregnancy, while rest of the sperm count, low sperm count couples, they fail to get pregnant. This is where the technology comes in. So let's see, we all know to have one pregnancy, we need one good sperm. And let's say an individual has got a 1 million sperm. 1 million sperm is still less compared to a normal parameter. So what is the technology is? The technology we use is not only to create more sperms, but the technology we use is to identify one good sperm with a DNA which is very good, and that sperm can give us a very healthy genetic disease-free embryo. That's the kind of sperm we'll look. And if our technology can identify those sperms, we use these sperms to create one embryo. If we get 4 sperms, we can create 4 embryos by using 4 eggs, and yes, we'll have 4 embryos ready, and we can have at least one child for that couple. So rather than treating low sperm count, we try to give them pregnancy which they want.
Can a woman get pregnant in her late 40s or 50s? Which technology can help them? I have heard your center is expert in handling such patients.
Yes, with the process of an IVF, women with the age of 40, 50 per se, postmenopausal women can also become pregnant. We are using hormonal replacement therapy. We are giving specific dosages of some hormones, and we are allow her uterus to become active. She is menstruating for 2 or 3 months. Her uterus becomes active. Uterine bed becomes good for the endometrium, and once the endometrium is good, then with the help of the embryo transfer, she can definitely yes become pregnant and feels her all happiness.
So what we essentially look in such patients with advanced age or menopausal is to create a good uterus. Age is just a number. So what we have a good uterus in which the baby can grow for 9 months. That's what is required. And what we need for a uterus is collection of endometrium, which is some amount of blood. So as Dr. rightly said, we start up on some tablets, which we give for 2 to 3 months. The blood gets collected, the uterus becomes healthy, the environment looks very good, and then what is needed is just an embryo transfer. So we do an embryo transfer in these couples, irrespective of their age, irrespective of their postmenopausal status, and we have done more than hundreds and thousands of pregnancies in postmenopausal women.
Many females suffer from irregular menses, PCOS. What do you suggest for them?
Irregular menses and PCOS comes with anovulation. Anovulation means unable to form an egg. These are different kind of females. Sometimes they come with the obesity, sometimes they are very thin but having irregularity of the periods. We need to see about the duration of marriage, whether they are married since 4 years, 5 years or 6 years. If marriage duration is on the higher side, then IVF is a boon for them because they are having many eggs. So with the help of an IVF, we can form many more embryos and they were really blessed with a child. If they are having obesity, then what we can do is like we can reduce their weight by using some kind of lifestyle modification. We can use some drugs to reduce their weight. We can regulate their periods, and then we can plan a pregnancy and we can give them a child. But definitely yes, irregular periods and PCOS is no bar on the not to have a child. They can become pregnant with these all modern technologies.
Irregular menses and PCOS are addressed as lifestyle diseases. So going by our fast food life and our stress life, most of the female usually have these problems. As Dr. rightly said, there are 2 ways of looking at it. First, you look upon a normal treatment. It's an irregular menses, it's a PCOD, it will get better with time, and they approach a wait and watch policy, probably waiting for biological way to work, and naturally pregnancy can happen. But most of the patients usually wake up and it's late and they have crossed 35 or 38, and that's where things start to become very tricky. So when we see such patients, we usually divide into two sorts. First, as Dr. rightly said, if they are obese, which is lifestyle induced. If it's lifestyle induced, we'll have a medical team to look into their hormonal imbalances and correct the lifestyle so that they can have a pregnancy at ease. If it's normal individual with a normal BMI, with a normal weight, then definitely we are not looking at lifestyle, but we're looking at some other hormonal factors which we'll try to correct. End of the day, if the couple have undergone, if the woman has undergone through a lot of years of infertility and now needs pregnancy, so we will use IVF technologies, analyze what is required minimum for us, do an IVF for her and get her a pregnancy, and not delay her dream of getting mother for a longer time. And it works very well.
Which age?
Age is no bar.
Age is no bar.
Nice.
As we have seen, we have given pregnancy at the age of 60, 62 also. So postmenopausal woman can also become pregnant. So age is just a number.
That's amazing. That's amazing, doctor. Are babies born through IVF technologies fit and healthy?
Yes, they are. In fact, they are more mischievous, naughtiest. They are the healthy and super attentive children, taken best care by their mother.
You must understand one thing. IVF is a technology where we use the egg and the sperm to create a babies. The doctors don't put anything DNA
Extra.
Okay, so it's a baby from your egg, from your DNA, and your sperm, that's your DNA. So it's going to be very well your baby. So they are fit and fine. We have used technology like PGD and ensure that it's a genetic-free disease. So we know they are fit, fine, and healthy. And as Dr. rightly said, most of our couples says that their childs are more mischievous thanks to IVF. But I think it's more about the upbringing of the child that makes them more mischievous. But anyway, they are all fit, fine, and healthy.
Very nice. If a couple has a previous child with a genetic disease, blood cancer, thalassemia, how can your technology, your center, help such couple? Can you tell us about this?
We can give them disease-free baby. With the controlled ovarian hyperstimulation, by using IVF technology, we can make there more embryos. And these embryos we are subjecting for the biopsy. We are making blastocysts in our lab, and we are subjecting this blastocyst for the biopsy, and we are subjecting this biopsy for the next generation sequencing technology. There we would come to know ki exactly number 1 embryo is having any kind of cancer, or number 2 embryo is having any kind of disease like congenital illnesses, number 3 is having some kind of thalassemia or somewhat. We could just able to choose the healthy euploid embryo, and that embryo we can transfer in the womb of the uterus, which would be totally disease free, and that female can definitely get a disease-free child.
You know, that's one of the latest innovation in IVF technologies, to have a genetic-free disease. You very rightly said there are number of couples having a first child with cancer or thalassemia. The major problem they have is they are ready to go for IVF, but they are scared because they don't want the next child to have such disease. So what is the technology available now? Okay, you can have a natural pregnancy and then wait for your results when the child is born. Keep on doing periodic results and understand if your child has got cancer or not. Now that's called sleeping with the enemy. You can't live with your doubts. You can't wake up in your dreams to see your child and imagine if your child is going to have a cancer at the age of 5 or 7. That's something morally spoils, because you've already seen an elder child suffer. So that's where IVF technology comes into focus. As Dr. rightly said, we come under a category called as technology called as pre-genetic diagnosis.
Okay.
So when we make IVF, we make these embryos and we use small biopsies and we send them to laboratories. In laboratory, we use the latest technology, which is foolproof technology called as next generation sequencing, NGS technology. By this NGS technology, we can study more than 200 genes, including the genes that we spoke about, including blood cancer also. And actually, let's say if we have got 6 embryos of a couple, we can place a marker like number 1, number 2, number 3, number 4, number 5, and 6, and so. And based on NGS sequencing test analysis, we can understand number 2 and number 3 embryo, for example, do not have this blood cancer gene. That's the embryo we are going to use.
Amazing.
So the number 2 and number 3 embryos will be hand picking up and transferring it to the couple's or the woman's womb. And now we are for sure when the child is going to be born, they don't carry these genes by which they will be having this. So this technology called as PGD or PGS, we can ensure the couple will have a child free of such genetic diseases. That's the beauty of this technology right now. And there are hundreds and thousands of couples who have used this technology and have a child free of any such genetic diseases that we can commonly speak about.
Can they create male baby or a female baby as per couple's choice?
Now every country has got its own law. So depending upon the jurisdiction of that country, it changes. For example, in CIS countries, in America, in Europe, you can use this. So we use technology for the same genetic diagnosis that we said. We can use a basic NGS technology or a FISH technology and can identify a male fetus or a female fetus, of a male embryo or a female embryo. And depending upon the couple's requirement, we can transfer and ensure before the child is born, we know that it's a boy or a girl. So it's very well possible technology which is used for family balancing or gender balancing. If you have got 2 or 3 daughters, somebody needs a male child, you have it. If you have got 2 or 3 male children and you want a female child, yes, you can use this technology and balance your family. But all depends upon the jurisdiction of your country.
You are solving all the problems.
Yeah, that's what latest updated IVF technology stands for. You see a lot of questions, a lot of problems, and do you have an answer for it? That's what the science looks for, and that's what BabySure stands for, to get the best of science for such couples.
Are these IVF procedures painful?
There is little pain, but joy of being mother overrides all the pain. Little injections the patient or the mother needs to take. Little time specification about the tablets is there, but sister will tell everything to her, she will manage it, she will overcome the pain and she'll become mother.
That's right. Pain is variable. We have seen couples who can, the sight of injections, cry, and some could have pricks and still feel good. Some could feel the pain of taking tablets also. Some could feel the pain of sitting home and doing nothing. Just imagine, you know. So pain comes in various forms, but what's more important is look at the joy. Is this pain going to be permanent? No, no way. It's the pain, the injection pain is going to be for 10 days. You have to take 10 days of injections. Tablets, yes, for first 2 weeks to 3 weeks there will be some more amount of tablets. As your pregnancy advances, the tablets will get less. 9 months of pregnancy itself is with pain, but just imagine it comes with a joy.
Of course.
Had it been only pain, no woman would have gone for pregnancy, but it comes with joy. It's a pain which is called an acceptable pain.
Sure.
And this loving pain and this dream of having this lovely pain overrides all sort of artificial pain which a doctor or a clinic will give. So I feel small amount of pain can be very well ignored, but the joy, as Dr. rightly said, this joy overrides all pain.
And I believe they are ready for that pain because
Yes,
they dreamed
100%.
about this
Sometimes
child.
they do ask, doctor, are there many more injections so that I should take those injections and my baby will become more healthier type sort of thing?
Psychologically
Psychologically
they
they
are
are
trying to get prepared.
What are the emotional stress the couple experience while seeking the IVF treatments?
It's a very important question and the topic that you have asked. Every couple who seeks fertility treatment or don't have a child are under a lot of emotional burden. Needless to say, financial burden, emotional burden, psychological burden, peer pressure, family pressure has just sunken their confidence. So they are under a lot of stress. And that's where BabySure family, BabySure team comes into focus. So we are a medical team handling medical case, but there are experts, are embryologists. They will make them feel confident about it. They will explain them the embryological procedures, the embryological steps, and make them understand what the embryo is. So you can understand these couples They hardly understand anything about science or biology. So getting them understand the science to their level becomes very, very important. And that's where my counselor team comes into focus. My counselor not only addresses their small issues like what time to get up, whether to sleep on the right side of the bed or the left side of the bed, to have relationship with their husband or not, how much water to drink, should they strain for passing urine or stools. There are small questions that comes. That also the counselor addresses. The embryology team will get them through the process of IVF. Medical team, doctors will talk about the reports, and then you have a specialized dietitian team which will take care of their diet. Now every individual has got different diet, but you imagine when you are taking special treatment, you start self-treating, you start making yourself diet things, and that becomes a bit of problem. So to understand everything, we have a comprehensive management where every individual comes into focus, and because of this the stress levels really goes down. Emotionally they feel that they have somebody in hand, they can talk with somebody, they have access 24/7 to our counselors, to our experts, to our dietitian, to our medical team, and that relieves their anxiety. And medical, it's known, if you have got something called as stress hormones, the success rate and the other hormonal changes play a major negative impact. So if you could somehow release the stress hormones and make the couple or the female relaxed, it just adds a couple of percentage to a success rate and makes the entire journey smooth and lovely and enjoyable.
Stress-free.
And stress-free.
Yes.
Plus here in BabySure, we are ensuring with unlimited IVF cycles. The very first time doctor told about all those things, so automatically the financial burden of the patient will get reduced. So financial support, mental support, stress-free environment will become her very happy.
Are there any special precautions after the IVF procedures? Dietary, rest?
There are nothing like special precautions. There are in general instructions followed. Now every individual has got an individual lifestyle. You can't imagine somebody living in India have the same lifestyle somebody living in US or UK. Though they have a normal lifestyle, but probably somebody will have a pure vegan diet, somebody will have a pure non-vegan diet. So the bottom line is not that we advise take vegan diet or non-vegan diet. The bottom line is to take a balanced food which will have all the nutrition. Our dietitian will help through it. We have seen most of the diet, patient lands up with constipation, and they have to, have this stress for passing stools, and that's not very good because that's add to the pain. You can have cramps at night.
Sure.
So that's the reason we emphasize upon special diet by which we ensure that the couple or the female doesn't get constipated, and we don't want her to have waking up at night with cramps in abdomen. So these cramps are not good. Second, about rest. We usually advise rest. So what is rest? Some individual perceive rest as lying on the bed for 10 days, 12 days, 14 days, 1 month. I don't know, which is inhuman. That's not possible. Actually there was a nice research after how much rest is rest and what is rest. So actually 20 minutes of rest in an IVF lab where the embryo transfer is done is good enough. Thereafter the female can walk out of the clinic and get back to her daily activities. But yes, you can imagine it's a lengthy procedure of 14 days and it's a precious pregnancy by going to IVF technology. So we don't advise them to start go to gym and do your running and keep on traveling and have a hectic life. No, we ask them to take it a little relaxed. A little relaxed. You don't have to stress out. You can walk down, you can relax. Just take as much rest as possible. Like, take time to identify what you like, enjoy your time. So, there are a lot of stress, like some couples will tell us that we don't have an elevator to take to our 4th floor or the 5th floor where we stay. What do we do? Okay, you can use the staircase, but you don't have to climb the staircase all at a time. Go slowly. If you have big problem, talk with our counselors. Our hospital will make arrangements for you to stay at our apartments for 2 days, 4 days, where your life will be at ease. You can do that. Second stress factors is what about cooking? Now,
Right.
to get up and to cook, oh yes, the moment you take a lot of medicine injections, the aroma of cooking makes you feel nauseating and you won't be able to eat it and because you won't cook it.
Right.
And then you have tantrums, you don't like food from the hotel. So that's something which our nutrition, our counselor and the husband, they all play a very important role and interact and try to solve this problem. So the anxiety and the special precautions keeps on changing. End of the day, all questions are, I will not say funny, but all questions are well practical. And we have to not only use medical wisdom, but we have to use logic to solve the special precautions. Medically speaking, 20 minutes of rest in the laboratory is well for us, more than enough for us.
After the procedure.
After the procedures of embryo transfer. But yes, we ask them to continue these good habits for 14 days or 3 months till the pregnancy is well short established, because that's what we are all waiting for so many years.
Yeah, so 3-4 months waiting.
Yeah.
Thank you, doctors, for joining and sharing your experiences with us.